Welcome to this LEX18 Digital Conversation. I'm Davidson. There are several birth options available for expecting mothers, and University of Kentucky HealthCare is here to discuss one that has been growing in popularity, and it's the use of midwives. Joining me to discuss this practice and what it means to the mother, baby, and the entire family, Joanne Barris, midwife for UK HealthCare. Welcome.
Thank you. It's great to be here.
You know, we were talking about this, and this was once upon a time something maybe our grandmothers, but a lot of younger moms now are really kind of getting into this. What seems to be the reason that women are choosing midwives over traditional birth plans?
I think the care from midwives is growing in popularity because women are aware of the morbidity and mortality rates that are rising in the United States, and they want to know what their options are. Midwives have really, really great statistics in terms of keeping their moms and babies healthy, and I think that's really attractive. I think a lot of women really like to be able to have time with their provider. We really try to give them that extra time, that high touch care that so many women value.
But this isn't just something that happens once you discover that you're pregnant. This is something that can happen even prior to that, right?
Absolutely. Midwives provide care from adolescence through menopause and beyond. So we can give care to the adolescent who might be having irregular periods, all the way to the woman who's going through menopause and needs hormone replacement therapy. So we really are able to care for women throughout the lifespan. And although most women think of us in terms of pregnancy and birth,
right,
a lot of our patients stick around because they have developed that really close bond and connection and don't want to leave after that. And we're happy to provide that care. It's something that a lot of women don't know is that we also provide primary care. So if you have an earache, a sore throat, the flu,
no idea, yeah,
we can help take care of you.
Because at the end of the day, you are nurses.
That's right.
Trained, licensed, and you just specialize in midwifery, right?
That's right. We have every nurse midwife has their registered nursing degree and license, and then goes back to graduate school for a degree specifically in midwifery. So we're all advanced practice registered nurses or nurse practitioners, and we specialize in midwifery.
Well, why was this something that you wanted to get into?
The short answer is God.
Yeah, that's the short, the long, and the every answer, isn't it?
It is. That's so true. But it very much was a calling for me. It was a calling that it was a big change for me. I had a really great, stable job that I loved with a boss who was fabulous and wonderful coworkers, and it was put on my heart that I needed to do something different. I have two children, so I've had two births that were very different from one another. And in my mind, it was the provider that made all the difference.
Right.
And so I thought, I want to do that I want to help other women have that experience of feeling empowered and heard and listened to and supported. It makes a huge difference.
And that makes all the difference, doesn't it?
I think so.
Yeah. And now, suppose, you go in with this birth plan that you're going to do this natural, you're going to have a midwife, you're going to do it at home, and then all of a sudden, as life does, things change.
Mm-hmm.
You adapt? How do you adapt, and how do you bring in the traditional medicine and the traditional process and still maintain that connection with that mom?
Yeah, that's a great question. So most people associate midwives only with birth at home. UK midwives, there are 5 of us at the UK Midwife Clinic, and we only attend births at the UK Chandler Hospital. Okay. So women who want home births will often come to us for their prenatal care. We can partner with them with their home birth midwife, and that's something that we can offer. But we only attend births at the Chandler Hospital, and we find that we are really able to create a home-like environment that happens to be close to any of the physicians in care that we need if any risk factors should arise. But midwives are experts in normal. So we are highly, highly trained to detect when birth or pregnancy goes outside of that. And we have really, really wonderful relationships with our physicians and our high-risk maternal fetal medicine doctors who we can either consult or collaborate with care for women to make sure they get the safest, most appropriate care for them.
Well, I had more of a traditional physician-assisted birth, but What always was curious to me was women who wanted to have pools and have their babies in water. And I get kind of the idea that you're transferring from the amniotic fluid into this pool, but how does that really, is that really good?
So we provide labor tubs.
Yeah.
Moms don't actually birth
in the tub.
tub
Okay,
at
okay,
UK, yeah.
okay.
They do at other places, but
Yeah.
at UK we have it available for women who want to use it as a comfort measure.
I was going to say
So
it probably helps.
that,
the
yeah,
bones.
the hydrotherapy really
Yeah.
kind of distributes the pressure that women feel
Yeah.
during contractions,
Yeah.
and it's very soothing for a lot of women. But it's important to keep in mind that women who see us, if they choose to have an epidural, they have that available. We can order that, and they can.
So it's not, oh my gosh, I'm never going to get something
Right.
like, okay.
Absolutely.
Right.
They have all the access to pain management that anyone else has when they come to the labor and delivery at UK.
Insurance companies recognize this as a birth option?
Most all do. There are some very, very rare, but most all insurance companies recognize us just like they would recognize any other nurse practitioner.
Now, when you see, say, a young person a young girl who's going into her menses, do you find that this is an easier conversation for her or experience than maybe going to a male physician in the white jacket in the sterile office and she's already probably afraid or nervous?
Right. I think we are really good at meeting women where they are.
Right.
And so if this is a 14-year-old who has questions about getting their period for their
Yeah.
first time, or what can I do about they're so painful, or it's very,
Right,
things
right.
that are very concerning to someone who is young, we can absolutely meet them where they are. One thing that a nurse midwife focuses on is education. And a lot of times, young women, that is exactly what they need. They need education about what's happening with their bodies, why they feel the way they feel, and most often it's validation that what they're going through is normal.
Right,
And
right.
if it's not, we are able to help them, whether it's prescribing medication or giving them guidance so that they can get the help they need to feel more comfortable in their own skin, which is what everybody wants.
Yeah, that's the ultimate achievement.
Yeah, yeah.
Now, once the baby's here, are you sort of the go-between between birth and the pediatrician, or can you do the pediatric care for the baby itself?
Yeah, that's a great question. Nurse midwives are trained to care for newborns through the first 28 days. But at UK, we have such a great pediatric team. You're probably familiar with our fabulous nursery and NICU. And I prefer to let them be the experts.
Right,
and
right.
so, if a patient has a question about, is the umbilical cord healing well, or something like that, we can definitely take a look at that in the clinic. But for their pediatric care, we have pediatricians and family medicine physicians and nurse practitioners at UK that are very highly trained, and we partner with them frequently so that they can continue their care in the UK healthcare system.
We're talking all in best case scenarios. But tragic things do happen, even at this most beautiful, special, sacred moment.
Yeah.
Do you help to counsel the mother if there's a loss of the baby? Do you help to counsel the family if there's a loss of the mom and or baby?
Yeah, so I say all the time, because I think a lot of times people think that midwifery is all, these glorious moments, and you're very astute to be aware that we see both extremes, and so our good days are really good, our bad days are really bad, and so I actually see it very much as a privilege, even though it's really hard, but to walk through that with a woman, and knowing that the first time you get a positive pregnancy test, you have already fallen in love. You are fallen in love with that baby, and that baby has made a place in your heart. So to me, it doesn't matter if you were 6 weeks pregnant or 40 weeks pregnant. A loss is devastating, and you absolutely need that steady, loving presence to get through that, and we absolutely can provide that care.
Yeah, because that can be very, very devastating. What do they call them? Rainbow babies, right? The ones that come after that.
Yeah, and talk about a privilege to be a part of a birth for a rainbow baby is really magical.
I bet, I bet.
Yeah.
Thank you so very much for stopping by. And thank you for stopping by. If you have any information, please do contact UK. They can put you in touch with the midwife staff there. There are 5 that are there to help you. Again, thank you so much for watching this LEX18 Digital Conversation. For more, just log on to our website, lex18.com. Until next time, I'm Dia Davidson.